Hey everybody, this is Dr. C from the Austin Gynecomastia Center. How are you? And we have an interesting case today, an educational case, and I appreciate my patient for sharing his case with the world, essentially. And his is unique because, let's zip over here, he's got pretty significant amount of gynecomastia, obviously. This is definitely advanced in the sense that it is rounded, it is tonic, it's pretty generous. Now, one of the things you'll notice, and we've talked actually about, his posture's just god-awful. It's terrible, right? But he knows that already. So, number one, posture's got to improve, and that means shoulders go back all the way. Now, this is the deal with his case in a nutshell. So we're going to treat all zones because he's got a lot of stuff going on. So zone 1 up front over here. Zone 2 is all this stuff over here. Let me see. Zone 3, he really doesn't have much. That's usually up here, but he's not that much over here. Now we're going to come down along here and hit a little bit of zone 4. Again, we're going to get zone 2 here, which is really full. Doesn't have much actually up here at all, so it's kind of an interesting zone. That's why I love my zone system. It helps me to kind of help my result. So maybe a little bit right there, but not bad. And look, when his shoulders go back, it even gets even better. All right, so the deal is, which is interesting, is you're going to think, oh, well, he's this size, so he's going to have a lot of tissue. But I don't think he really does. It's going to be I mean, he's got gyno for sure, but it's not going to be like the home run. We love the glandular tissue. He's going to be mostly fiber fatty in nature. So what I try to tell you there is that these mountains, or any mountain, or any gyno, or any breast-like feature here could be made out of a lot of stuff. And it doesn't necessarily have to be the gland. You don't have to feel the gland. You don't even have to have the gland. Most people do, and it's underneath the nipple areola complex, but you know that this is gyno tissue because that's what's making this whole thing projected. Now, in his particular case, it's someone could see him and say, well, you know, he's this is big, we need to do a periolar approach and come around here and do a pizza pie scar at least, or we would take out all the skin and make a scar go over here and move the nipple and all that stuff. But my experience would say, no, that's actually not going to happen because I think this skin is going to go back pretty nice. Now, it may not be perfect, but it's going to go back pretty amazing because I have two choices. Basically treat it with my traditional method with no scars, essentially, or we go to the skin excision method, which means there's scars either around the areola or across the chest. I prefer not to have those scars if you don't need them. So that's why this is an important determinant. If we're going to cut out skin, there's no going back. Once you have that skin gone, it's gone. And then you have these scars. I'd rather have him an imperfect but nice result with something that looks natural. In fact, if we really work this pretty good, we're going to get an amazing result. So posture is number one. I'll also notice on him, he's got a fuller chest over here than over here, and I dare say it's because of his ribs. His ribs feel more prominent than this side. That's why he doesn't seem as full on this side. So it's an important thing for me to say so that if he sees these differences afterwards, because he's going to be seeing more of his pec muscle, we just know that's just something we saw before. Another important thing is he has a weight history that's kind of been up and then down, up and down. He stopped smoking, which is phenomenal. That's just music to my ears, and I agree with his doc who said it's better to have a little extra weight than to be smoking. Smoking kills you. Extra weight is not good, but a little bit is okay. So one of the things that I want to do is sort of help him help himself, and we're going to treat all his upper chest, and then I want him to totally engage exercise, new lifestyle behaviors to get in the best shape of his life. Because obviously this affects us in a lot of ways, and once he gets his head clear, he's then can engage exercise and really just get in the best shape of his life. That's the true home run. So then he's not smoking, he's in great shape, and the weight is where it needs to be, so he leads a long, healthy, and happy life. So anyway, one of the things we're going to do in this video too is pick it up where tomorrow we'll show his before and after. So this is going to be a good one, and we can't wait. So we're going to go in and help him, and you'll see this cool video, and hopefully you'll pick up something nice.
Hey guys, so we are with this patient from yesterday. So he is obviously 1 day post-op, and we are about to take off all the wraps, all the dressings, and he's going to see himself for the first time. We're going to see him for the first time. So usually this can be kind of interesting. And I've already told him, of course, it's not going to look perfect, but it's definitely going to be a change from where we were yesterday, okay? So keep that in your mind, and let's see what we've got. So sometimes you can get dizzy the first time you take off the compression garment. It's almost like it creates a fluid shift in your body, so be aware. And let me know. So that's obviously why I have him seated right now. Just take everything slow. Try not to be tense or tight. There you go. So I always tell people that it's low maintenance as far as the dressings, because you don't have to change it the first night. Usually the first time you change the dressings is when you come here in the office and see us, and we do it for you. So you can already see the big difference. Got you the long one. Do you feel okay?
Yeah.
Okay, stay right there for me. All right, what do you think? Do you feel all right?
Yeah.
Okay. What do you think?
Good.
So, Anna, if you'll zoom in, you can see the difference in just one day. And then something else I always like to look at is the side view here. So Anna, if you'll come on this side of me, this will go that way. Can you see it? Mm-hmm. So you see all this fullness down here, it's no longer there. As soon as he starts working out, he'll be able to see the line of his pec, which he obviously couldn't do before. So it's a huge difference in just one day. And of course, he has a long ways to go in his recovery process. We did some internal flaps in there, so we asked that he doesn't work out for about 4 weeks, and then he can start working on the pecs. But it's pretty remarkable, right?
Big difference.
Okay.
Here we are, and here we are. So this is my man, post-op day number 1. He looks like a zombie, okay, because he's holding his stuff really kind of stiff because it hurts, right? Yeah. So remember, the important part is, this is what he was, all this, okay? So it's actually a lot we can talk about here. So look at these breasts and look at the non-breast situation. So I don't usually use the term breast, but he had breasts. It's a chest, but we call it a breast if it looks like a breast, and that really looks like a breast. So remember, in his case, I did all 4 zones. So remember, I did everything above here, up under his arm. Here's his pecs. Give me a little flex. So you can see his muscles are flexing already, which is kind of sweet. And the most important thing is look at how the skin has already gone back beautifully. So his skin retraction it's just remarkable, okay? It's already gone back. I want his nipples to go higher. So we're going to pull up on his skin, and he's going to keep his shoulders where they need to be. But it's really an impressive example of skin going back the way we hope it goes back. And we didn't need to have any periareolar incisions, which basically is a pizza pie around the areola, or even scars across his chest, which some surgeons may have recommended just based on seeing what they see here. But the capacity of the skin to retract is really phenomenal. So all in all, how was it when you first saw yourself? Was it weird?
Weird, yeah.
Yeah, weird. Like how weird? Like what? Just
I don't know.
you don't even know what you're seeing, right?
Right.
Yeah, so he doesn't even know what he's seeing. So it's kind of an adjustment. He's going through this adjustment, and we have to figure out, I don't know what it is. Maybe he can let us all know when he goes on to some online chat room and kind of talks about the adjustment. So one of the things that we did talk about is he's going to just refine this, lose a little bit of weight, get in the best shape of his life, so that's pretty cool. Now from here, you can also see he's really not that bruised. Not at all, actually. This is where the garment kind of cuts in, but we did all 4 zones, so he's actually rocking. So we're going to talk a little bit about Mondor's, and it's a condition, okay? And it sounds terrible. It's MONDOR', but Mondor's is superficial inflammation of the veins. Now, in his particular case, we did all 4 zones of his chest, so we did everything. His lymphatics are up under his arm in this area over here. And what we find is Mondors is a self-limiting condition. It goes away by itself, but it does cause significant sort of irritation and pain and discomfort. And instead of waiting for it to show up, what we like to do in his particular case is start him off early. So we're going to get him going on Motrin or Relieve, 1 tablet twice a day for about 7 to 10 days. And that's going to not only give him pain relief, which is really all he needs. He doesn't need narcotics, but it'll also keep Mondors at bay, which just delays the wound healing process. And then he's going to do his rolling in about 2 weeks to get the skin to go back even nicer. He's going to exercise great posture. He's not going to drink a lot of fluids. Don't go through this whole thing of thinking that you're going to drink a lot of fluids to get healthy. What that's going to do is just actually put a lot of fluid in him, and then he can get a seroma. And since he's from elsewhere, you know, you'd be calling me on the phone and saying, hey, Bob, I got a seroma. I'm like, okay, well, you're there and I'm here. So just prevent it to begin with. Another thing which is really cool about it is he's really not that swollen. Mm-hmm. Which is really remarkable. I mean, when you think of how much we did you drink a lot yesterday? I don't think so, right? Were you dry? Do you feel dry?
A little bit.
Yeah, so he probably feels a little dry. You feel lightheaded?
No.
No, okay. But dry meaning you could just tell he doesn't have a lot of extra fluid or swelling. This is actually a remarkable appearance for just the next day, which is amazing. Did you talk a little bit about his discomfort last night and everything?
No.
How was it?
It was uncomfortable.
It was uncomfortable.
What would you say it was similar to? Like a lot of guys say it's similar to working out, like 500 push-ups. Would you say?
It was
500.
the first time snowboarding when my whole body just hurt. Like,
so we're using your upper body and just kind of bouncing around and stuff.
Yeah.
But how's it feel today? Better or
better.
worse? But you're stiff.
I'm stiff.
Because when you move, it hurts?
Yeah.
Yeah. Which is a good point here. So I understand it hurts, and so you want to baby it because when you move it, it just makes it worse. But on the other hand, you never want to be still for more than like maybe 2 days or so, because what happens then, you kind of get into this whole not moving, it gets stiff, and then it gets stiff and you're not moving. So move it out and stretch it out and all that kind of stuff. And then when he takes the Motrin, that'll help tremendously as well. What other final thoughts can we have in this case? I mean, I just think it's a really interesting case in the sense it just demonstrates, A, a person that didn't need skin excision, B, a pretty remarkable result early on, and then really what I hope in a few months, maybe 6 months or so, he'll be sending me that picture of him slim, you know, going to the gym, and really this is, so, and then clearing your head, really, which is the bottom line. So this is not something we talked about, but basically I want you to make sure he puts himself in a good position to get his head where it needs to be, because he's rocking, and we want him to rock and feel good about himself and look in the mirror and get all the feedback that he needs. And as I'll tell all my patients, I appreciate you guys coming here because you have choices and they chose to come here, and it's an honor and a privilege. I mean, hopefully we served them well, and it's good to have you guys. So anyway, that's our video, and hopefully we get some follow-up with him. If you could take some pictures like you did here, or even like how they initially send them, like typically in the bathroom where it's like taking that thing. But we really want to see how he looks, let's say in 6 months from today. But you could tell you could kind of get an idea what's going to go on, and what's going to happen is it's just going to even get better with time. So we look forward to those pictures, and then we'll put this thing all together and we'll get it out there. Thanks for watching.